Hello, I'm Dr. Dennis McKenna. I'm joined today by Dr. Venditti, our hospital system general director, giving you the update from Albany Med on the situation related to coronavirus. Today is day 23 of our incident command. In Albany County, they are reporting 217 positive cases of patients with COVID-19. Inside the medical center here, we currently have 25 patients with COVID-19. Yesterday we had 18, so Fred, that number has gone up since yesterday.
It has.
We have 14 patients on the floor. We have 11 patients in an ICU setting, and 5 of those are on a ventilator. In addition, we talked to the local area hospitals, and we know that the number in the region, which includes approximately a dozen hospitals, has gone up from 83 to 97 since yesterday. Today, we're wearing shirts representing respiratory therapy. And Fred, this incredible group of care providers reports up to you. What would you like to say?
They do. They do a tremendous job. Maureen Dixon, their leader, does a fantastic job as well. These people put themselves selflessly in harm's way at the bedside every day, helping us to care for COVID-19 patients. Thank you.
Yeah, we do thank them for the remarkable work that they do. So yesterday, Fred, you gave me a quote. I thank you for that because I must have received about 10 pictures of Winston Churchill yesterday from my friends telling me about that quote. But in addition to that, we both received an email from an employee who gave us another quote. And that quote was, when you change I to we, you can change illness to wellness. And we both thought that was a remarkable quote.
Yes.
It speaks to the community spirit and the fact that we're all working on this together. And so, to that point, yesterday we spoke about PPE, and we talked about a plan for face shields. And I think you have some great news about that.
That's right. We talked about a way to extend the use of masks, of surgical masks, by using face shields to cover the mask and allow it to be used literally for hours, room to room, not getting soiled. So we've actually received some prototypes. We'll model them for you from UAlbany. Pretty comfortable, right?
It's very comfortable. I can breathe very well. I can see very well.
Yep. And they're deep enough in terms of how low they go that they cover the mask and prevent those droplets from hitting the mask. So we want to thank UAlbany for the shields. They think they can actually ramp up and make hundreds of them, so we'd like to thank them. Jennifer Goodall, the Vice Dean of Emergency Preparedness at UAlbany, and also Mark Abrams from Rancher Labs. We would like to encourage anyone else out there who thinks they could help make masks like those face shields, to reach out to us. We'd be happy to accept them.
Yeah, it's an incredible example of the community response, and I also would like to extend my thanks to the University of Albany, and we look forward to using those.
Absolutely.
Yeah. Fred, you wanted to give us an update on the surge plan. I know there are some changes there, and you mentioned this is a dynamic process, so what's the update there?
That's right, Dennis. So we said last week, we had a plan that we actually submitted to the state at the beginning of the week, but it was going to be sort of a living, breathing document. We were going to change it as we needed to. So there have been some things that we've decided needed to be altered in the plan. We've actually met and talked about that today, some of the trigger points, those kinds of things, and how we coordinate between, let's say, respiratory therapy, critical care, nursing, and some of the other services that are critical to the surge. One of the things that we've decided to do today is to consolidate our surgical cases from South Clinical Campus to the main campus. Because of our compliance with the state's ask for us to reduce elective cases, of non-essential cases, the volume of surgeries there have gone down. So we can safely bring them to the main campus, and then that frees up space on South Clinical for us to take care of patients as the surge comes, and that's part of the plan.
So we will still be able to do all essential surgeries, but we would move them from South Clinical Campus to the main.
You got it.
Okay, very good, very good. The last topic we wanted to talk about today is transfers. Now, Fred, you and I were both part of the build-out of the transfer center almost 15 years ago.
Yes.
We did that at the same time. And for those of you who don't know, Albany Medical Center is a hospital which has, for the last 15 years, taken transfers from regional hospitals and beyond. The numbers are pretty significant. Last year, we took over 16,000 transfers to our hospital from regional hospitals. That averages between 40 and 50 transfers per day. And what that means is, back in 2019, if you were a patient inside our hospital, 1 in 4 of those came as a transfer from the outside hospital.
That's right.
That's been our mission. That's what Mr. Barba had asked us to do. He declared us a hospital's hospital, and if there was a need and we had the capacity and the capability to care for that patient, we took that patient. And so the question has been asked, what role would the medical center play in this current state of COVID-19? Will we take transfers in if they have COVID-19? And the answer is, of course we will. That is our mission. That is what we're here to do. And whether or not you have COVID-19 or not have COVID-19, the medical center is always prepared to take transfers in when we have capacity to do so. And we often run a hospital at a very high census. And we have to try to balance out transfers that are coming in and business on this campus. We've always been able to do that, and I think we'll be able to do that as well.
Absolutely, Dennis.
So I just wanted to address that issue and put that right in front of you right now, that we're thinking about that, and we'll see what happens in the next couple of days.
Yes.
Okay, very good. So that does it for today. We'll be back here again tomorrow. We thank you very much, and we ask you to please take care of yourself. Please take care of each other. We'll see you tomorrow.